Good morning. My name is Dr. Zubair. I am a cardiology specialist in Aster Speciality Medical Center, International City. Today we are going to talk about the cardiovascular disease in patient of diabetes mellitus. Before I go to major talk, I'll just give the overview of the diabetes mellitus. Diabetes mellitus is a chronic condition which is associated with many complications, which includes coronary heart disease, which leads to heart attack, cerebral vascular disease, which can lead to the stroke, retinopathy, which can lead to the blindness, nephropathy, which can lead to the kidney failures and dialysis, and the peripheral vascular disease or the neuropathies. Initially, in many of these complications produce no symptom in the initial stage of the diabetes mellitus and can be prevented or minimized with a combination of regular medications and the clinical and cardiac care. Our major topic is the cardiovascular disease today. So heart disease, especially coronary heart disease, is a major cause of death in patients with diabetes mellitus. At least 68% of the people aged 65 or older die because of diabetes mellitus or some form of complications associated with cardiovascular disease in case of diabetes mellitus. Compared to the individual without diabetes, diabetes is associated double risk of the heart attack in cases of the diabetes mellitus. And these patients more likely to have a heart attack and even silent ischemia without any symptoms of the heart attack. If you talk about the heart attack, diabetes is associated with an increased risk, and one large studies in 52 countries give us an idea that 10% of the patients of diabetes associated with the heart attack. Some diabetic patients have a blunted appreciations of ischemic pain, which may result in non-classical chest pain, silent ischemia, or even silent heart attack. Mainly, if you see, the diabetes is associated with an increased incidence of complications associated with cardiovascular disease. If you go with this diabetes mellitus, why the people of diabetes have the cardiovascular disease more as compared to the non-diabetic patients. Diabetes is treatable, but even when glucose levels are under control, it greatly increases the risk of heart disease or stroke. That's because people with diabetes, particularly type 2 diabetes, may have other major contributing risk factors associated which can lead to the heart disease. And one is the most common is the hypertension. Many studies confirm that diabetes and hypertension are two associated risk factors, and usually the diabetic patients eventually develop the hypertension in their life. And the patient with diabetes and hypertension have the double than the normal risk of heart attack. Patients with diabetes often have very high cholesterol level also. High bad cholesterol, we are calling the LDL, low density lipoprotein, low good cholesterol like HDL, and very high triglycerides. These combinations we are calling the diabetes dyslipidemia. This is also one of the other contributing association with the diabetes in case of the myocardial infarctions. And then obesity is one of the most common reason of diabetes mellitus. Physical inactivity, which is also another reason of diabetes mellitus and lead to cardiovascular disease. For example, if you have the family history or other risk factors for diabetes, or if you have been diagnosed with pre-diabetes, the level before you are diabetes. If you go to the clinicians, they will tell you what is the pre-diabetes and what the level and what are the care you can do to prevent or develop the diabetes mellitus. There are a number of healthy living tips you can follow to prevent or delay the occurrence of diabetes mellitus. If you have already been diagnosed with diabetes, these tips can slow the progress of the disease. Many studies show that lifestyle changes such as losing weight, daily exercise 30 minutes a day, more than 5 days a week or at least 7 days a week, increasing physical activity can dramatically reduces the incidence of complication associated with diabetes mellitus, and are also important to control the sugar level and cholesterol level. These lifestyle changes can help minimize other risk factors as well, such as high blood pressures and cholesterol, which can have a tremendous impact on people with diabetes. In many instances, lifestyle changes must be complementary by a regimen of medications to control blood glucose well, high blood pressure and cholesterol, as well as to prevent the heart attack and stroke. Start each day with grateful and healthy heart. Thank you.